Hello guys, how's you all doing? I'm back with a new video. And if you want the complete information about MBBS Abroad, do not skip a moment. Watch it complete and share it with your friends. Doctor is one of the most respected job. MBBS Abroad is also an option. Student thinks who are not able to get admission in Indian medical colleges due to the level of competition in between the Indian students, and also there's less number of government seats. And the main reason why they think of MBBS abroad is because of the fees difference in Indian private medical colleges and colleges of other countries. And when we think of MBBS abroad, we think of these countries. First, Russia. It is the most preferred country for MBBS abroad. Then China. Then Ukraine. Then Kazakhstan. And Kazakhstan is one of the cheapest country for your course, for your MBBS. And also some other countries like Bangladesh. For your admission abroad, you definitely need a counselor or agency. And now the point is that what the counselor or the agency do is to provide you the proper knowledge about the education abroad or the college or the country where you are preferring to go. But they will never tell you the negative points about the education abroad. Although their job is to provide you the right information and they want your admission done. That's what they are paid off. A counselor will never tell you about the negative points of education abroad. That or a student can tell you. There are a lot of problems you face when you are abroad during your courses, which we can further discuss in the video. Firstly, let's discuss about your fees. Starting with your tuition fees. If you select a good university or a top rated or a preferred university for your MBBS in abroad countries, the minimum tuition fees you have to pay is around 20 to 25 lakhs. That includes your 6-year course tuition fees and also the hostel and the mess charges, along with the hostel and mess charges for the whole course, not for a single year but for the whole course. Now, your traveling charges. For example, your course duration is around 6 years and you are visiting your country or you are visiting India once in a year. Then the charge around the round trip from, if you are going, for example, if you are going Russia, then the charges of round trip back to India a year is around a lakh LX. That means 6 lakhs for your full course. Now the other expenses and now the daily expenses, which help to fulfill your basic or daily needs. Let's take it around 1 lakh per year. And last, the visa and the formalities, that is your consultant fees, your ticket to the country, your first year fees, your admission charges, in the university. Now let's take it around 2 lakhs for your visa and formalities. Now if we total the whole MBBS fees will be around 45 to 50 lakhs. With this money you will be a Russian doctor if you visit to Russia. I'm not saying that you can only be a Russian doctor. For example, if you are going to Russia, then you will be a Russian doctor. That was the thing of money. Now let's come to your talent part. With that money you can only be a Russian doctor if you are going to Russia or another country. That was just an example. And now if you want to practice in India or want to be an Indian doctor, then you have to clear the MCI exam, which will allow you to practice in India. And the success ratio of the exam is around 20%. And another thing that belongs to your talent or your intelligence is you have to do is to learn their language where you are going for your MBBS, because not every colleges complete their course or the study in English language. You have to cope up with the patients during your course, so you have to learn their language. And now get back to basics. What if you clear the MCI exam? If you clear the MCI exam, the Indian government will allow you to practice in India for 6 months. Only for 6 months. Obviously, a government medical hospital will be provided to you for your 6-month practice program. But what after the 6 months? How you can practice in India? After 6 months, I think you have to go for clinic, for your personal clinic, and that takes lot of money to set up your clinic in a good city. The expenses would around be 40 to 50 lakhs, because for sure with that 6-month practice you cannot go for a reputed or good hospital in our country. You have to open up your clinic to make your name, and the expenses for your new clinic in a metro city is around 50 lakhs. You have to pay. With your MBBS degree, you are just a physician. You cannot perform surgery, and for that you have to complete MD or MS. And for MD and MS you have to compete for NEET PG with those students who completed their MBBS in India, in Indian medical colleges. And with them you lost 6 years ago during your NEET UG exam. And if you get admission or clear the NEET PG and get an government college, that's a great thing for you. And what if you cannot able to get a government medical college for your MD or MS? you have to go for a private medical colleges, and then the fees must be a very high. It must be around 50 lakhs for your course in India to complete MS or MD. Then you can be a surgeon with completing your MD and MS course degree. With this degree, you can definitely go to the top rated or the most reputed hospitals in our country to do your service and to make your name. Let's do a total sum up of your time and your expenses during your course. Let's start with MBBS. The expenses were around 45 to 50 lakhs. Then your clinic expenses, that were around 40 to 50 lakhs. And the last, your MD or MS in private Indian medical colleges, that is also around 50 lakhs. And the total sum up of all the money is around 1 to 1.5 crore and 10 years of hard work to be a good surgeon. Look, these things of going out is okay for the student whose parents are doctor and they have their own personal clinic or hospital, because after completing our MBBS degree, when we come back to our country, we can directly go for our clinic or hospital, because our parents have that own government, or not government, but own hospital. Or also for those who have lot of money, they can do. But for the middle class, I'm not saying that do not go abroad, but think wisely what you are doing, because it's not a short period. You are far away from your friends and family, and also a huge amount of money is on you. I'm not saying that it's a very high amount of money, because our government also helps the students which go abroad for the for example loans and all the things, but you have to pay back the money, and it's your call, your opinion. If you want to go abroad, you can go. I'm not saying not to go abroad. It's all your thinking, your prescription. And last, thanks for watching the video. Give it a big thumbs up and do subscribe the channel, because lots to come for you. And also I'm providing my Instagram handle in the description for your further suggestions and your doubts. Thank you. Be safe. Have a nice day.